Hello everyone, today we are going to study about how to read the chest x-ray. So let's go with the topic. So for reading the chest x-ray, we have to know about the six thing. So the letters I, T, S, B, H, L, and then we have to know about three letter of each or three things about each, and we have to see these all things in the chest x-ray so that we will not miss anything in the chest x-ray and do the read the chest x-ray confidently and without missing anything. So let's go with the what are the these things. So for the I is identity. So the identity of the patient, which like name, date, and the view of the x-ray. And for the T, technique. So for the in the technique, like the x-ray is in the center or not, like exposure is maintained or not, and the x-ray is taken in the phase of inspiration or not, we will see that. And for the S, we will see soft tissues. In the soft tissue, we can see the neck, abdomen, and the thorax. And for the bone, we have to see the spine, clavicle, and the ribs. And for the heart, we have to see the shape, size, and the hyla of the heart. And in the lungs, we have to see the outline, trachea, and the lungs. So these are the things we need to look at the x-ray. So let's go the thing. So for the eye identity, techniques of tissue, bone, heart, and the lungs, and for each three we have to learn. So for the identity, name, date, and the view, and for the technique, center, exposure, and the inspiration, and the soft tissue, neck, abdomen, thorax, bone, spine, clavicle, and the ribs, and for the heart, shape, size, and the hyla, and the lungs, outline, trachea, and the lungs can be seen. So for seeing in this patient, so for the eye, so the identity, so identity is name, date, and the view. So the name is given here, and the date is given here, and the place where the x-ray is taken, and the view is generally not given here. So but the right side or the left side of the um, body part is mentioned there. And so we have to first look at the identity, like if we go to the ward, and then the same person you are watching the x-ray, and that is the same patient which you are watching the x-ray of. So we have to always confirm that at first before looking the x-ray. And the date, like if that x-ray is of 2 to 3 years ago, then there is no point of watching that x-ray. So we have to also get to know about the what which date and this is taken. So for the technique, the three things in the technique is it is in the center or not, center, exposure, and the inspiration. So for the center, like trachea is in the center, and for the exposure, we have to see like if there is seen you can notice like if there is interspinous process here, but like when it goes below, it must there must not be seen of the like interspinous space. So there is no interspinous process in below, but here is present. So this is the good x-ray. And for the inspiration, like lungs is fully inflated or not, you have to look as like lungs is fully inflated or not. And for the s is soft tissue, you have to look for the neck, and the another is abdomen, and for another is the thorax. You have to look at the thorax region. So for the soft tissue, we have to look these things. And for the bone, we have to look the spine, clavicle, and the ribs. So for the spine, you have to see this spine, and Then for the clavicle, you have to see as the clavicle is in the same level or not, like the head of the clavicle is in the same level or not. So after looking the clavicle, we have to look for the ribs. So for looking the ribs, you have to always look, there is always the confusion between the first rib. So always identify the first rib, then second rib. Like the first rib will rotate on its own, but this after the second rib, then it will go along with the lungs. So you have to always look for that before the confusion. So in this, here is the rib, okay, first rib, and then second rib, and third rib, fourth rib, fifth, sixth, seventh, eighth, ninth, 10th rib is seen. So likewise here, the first rib is here, okay. This is a trap, you must not be fallen in this trap, okay. Second rib is this, okay. Like that you have to see all the ribs. So for the heart, you have to see the shape of the heart, and then the size of the heart. So for distinguishing between the there is the cardiomegaly or not, the heart size should be less than 0.5, not more than 0.5, or the one half of the thorax diameter. So for calculating that, you have to get the one center point, and then the heart is this, okay, and the half part of the thorax is this. So if we calculate this as a B, and then this as a C, and then this as a D, so A plus B should be always lesser than C, okay. That is the thing, okay. So if we consider this as a E, then A plus B should be lesser than D plus E. So the E and the B are the same, so A plus B is lesser than D plus B. So B we cancel, so A is always lesser than D, okay. So when you get the x-ray, so you just see the A and D, okay. Get one middle point, and then see if like the diameter of from the here to here is greater or lesser than the this diameter. So if A is greater than D, then there will be cardiomegaly, okay. So one concept you have to always get to know about is that if the x-ray is like posterior anterior, then the cardiomegaly is if the heart is greater than 50% of the total thorax. So if the x-ray is anterior posterior, Then the first come when the X-ray is taken. Then there will be the uh, like technically there will be the higher diameter of the heart is seen, because heart come first when we take the anterior posterior diameter. So up to the 60% it is normal if the X-ray is taken from anterior posterior view. So for the lungs, you have to see the outline of the lungs. So for looking the outline, so mm, you have to go this way. Okay, if there is any abnormality in the between, you have to look this way outline. Okay, this. Okay, so outline is this. If there is any effusion or any thing like abnormality or the normal deviation from the normal condition, then you have to look for the which lobe is affected at that place. So for the outline this is, and you have to see the trachea, if there is any deviation of the trachea or not in the X-ray. And then you have to look inside the lungs if there is anything which you found abnormal in the lungs. Okay, so this is the patient. So first we have to look the eye, so identify the patient, the identification identity. So name, time of the like the date, and the anterior posterior posterior anterior, which is not mentioned here. So then identity, you have to go to the technique. So in the technique, is the X-ray in the center or not? And for exposure, I have said that you have to look this, and which is getting not seeing below. So this is the good X-ray. And then the inspiration, as the lungs is fully inflated or not, you have to see. And for the soft tissue, you have to see in the neck side, thorax region, and the abdomen. Okay, so after that soft tissue, we have to look for the bone. So in the bone, first we have to see the spine, it looks normal. And then you have to see the clavicle, the head of the clavicle meets or not at the same place. And then the rib. So for looking the rib, uh, you should not miss the first, this is the trap. Okay, first and then second, other is clearly visible. Third. Okay, these are the things which you should not miss. Okay, so one abnormal X-ray we'll see. So yet in this also we have miss. Okay, up to the bone we have covered. So in the heart, we have to see the shape of the heart, and then the size of the heart. As the technique, you have to, so this is greater than this, so there is no cardiomegaly. And then you have to see the hilum. This is the hilum which is seen in the heart. Okay, and then heart, then lungs. For the lungs, you have to first look the outline of the lungs. And then trachea, you have to see the trachea, and then the lungs, inside the lungs. Okay, And mm, so in this we have to see the identity date, and then the exposure like view, and for the technique, so it is in the center and the little bit seen the interspinous process, and then it is in the inspiration or not clearly seen. And then for the technique, it is and the soft tissue neck in the thorax. Here you have to, you can see some wire is placed here, so always do not leave the soft tissue, because you can miss these things. So here is the wire, so soft tissue, and here is the whitish part, and the bone, for the bone clavicle, little bit is seen, and then for the spine, whitish part is seen, and for the rib, mm, mm, not clearly seen. Okay, so first, second, third, fourth, fifth, sixth, up to the sixth rib is clearly seen, little bit seventh rib also. And for the heart, the this is greater than this, so there is the cardiomegaly is seen. And after the heart, the lung, we have to see the outline. So for looking the outline, here is the disruption of the outline, so lower lobe of the lungs are involved. And so for the lobes, upper lobe, middle lobe, and the lower lobe. So for the left lung, there is only upper and the lower lobe, so we have to look for this. So next x-ray, and then we'll continue, we'll in this. Okay, first identity, name, name and the date, and the posterior anterior view, and the left side of the, this is the left side. And then after the identity, we have to get to know about the like technique of the is in the center or not, and then the exposure is okay, and then it is in the inspiration phase, and then you have to see the soft tissue, okay, soft tissue, you have to see the soft tissue, and then you have to see the bone, so the bone, spine, clavicle, and the ribs. And then heart, the shape of the heart, there is no cardiomegaly, and the hyla is also seen. And then the lungs outline, and then trachea, and then the lungs inside is seen. So this is the method of the interpretation of the chest x-ray, or the how to see the chest x-ray, and what are the disease or the condition which are seen, or which should you know after looking the chest x-ray. I will discuss in the next video, but this is the best technique to read the chest x-ray. So thank you everyone. Thank you.